Hello, good evening. This is Dr. Subhrajit Nath. I am a general surgery resident from Medical College, Kolkata. So today what I am asked to tell about is the vitamin B12, its role in our body and the deficiency syndromes associated with it and its absorption and the related factors which hampers the vitamin B12 absorptions and leads to its deficiency. So vitamin B12 is basically water soluble vitamin which is not produced inside our body. So it has to be supplied from outside. So the sources must be exogenous. So the food that is mainly rich in vitamin B12 is mainly animal source. So like various kind of meat like chicken, mutton or beef or pork, those have a good amount of vitamin B12 in it. Along with that, egg, milk, like yogurt, curd, those also have got vitamin B12. So vitamin B12, what does it do inside our body? So vitamin B12 is basically a protein which is associated which helps in DNA synthesis. So DNA it is present in inside every cell of our body. So if DNA synthesis does not occur, it will hamper the cell division process. So new cells cannot be formed. So its role mainly lies in our the reticular endothelial system, that is the production of the new blood cells, that is gets hampered when vitamin B12 is less in our body. And also the nerve fiber, it helps in maintenance of the nerve fibers. So basically what happens is if there is less vitamin B12, new RBCs, the red blood cells are not formed. Red blood cells are not formed and they become big in size because they cannot divide. So that leads to a type of anemia which is known as megaloblastic anemia. And also it helps in the nerve fiber myelination. So if myelination cannot happen, so nerve fibers are not as active or effective like it should be. So it leads to a whole lot of syndromes. So what I told earlier is anemia is one of them, and along with that, there will be a like problem with our nervous system, like our brain and the peripheral nerves that gets affected. So what happens is the patient will present mainly with neural symptoms or blood related anemia related symptoms, like the patient will complain of weakness, fatigue, these kind of things, or they can complain of cognitive disturbance, behavioral disturbance, memory impairment, and maybe pain, chronic pain, headache. These kind of symptoms will appear. So these are the problems associated with vitamin B12 deficiency. Now, how is vitamin B12 gets absorbed inside our body? So vitamin B12 is present in the food inside our food that has to be supplied from outside. So it is bound with various food proteins. So when you intake that food, it gets inside our stomach. Then the stomach, we have got the HCl, the hydrochloric acid, which is secreted by the cells of the stomach. That acid helps in the cleavage of the protein and it cleaves the vitamin B12 part from the food proteins. Then that vitamin B12 binds to another protein which is known as haptoprotein. Then it travels, that complex thing that travels down into the duodenum. And inside the duodenum, it binds with another important protein that is known as the intrinsic factor, Cassell's intrinsic factor, which is also formed inside or secreted from the stomach cells. So from that, the intrinsic factor and vitamin B12 complex, it travels further down and goes inside our small intestine and specifically inside the ileum. In the terminal part of the ileum, it gets absorbed in a mechanism which is known as endocytosis, and it gets inside our blood and it travels down further and goes into the nerve cells or into the organs which produces our blood cells, and it carries out its function. So why is the deficiency of vitamin B12 occurs? So as I mentioned earlier, its source is exogenous. So if you take less vitamin B12 in your diet, that will lead to its deficiency. So there is a thing known as the RDA, the recommended daily allowance of vitamin B12, that is around 2.4 micrograms. That should be the daily intake for an average Indian adult. And for pregnant and the lactating woman, the requirement further goes up. It is 2.6 and 2.8 micrograms respectively. So if you take less vitamin B12 in your diet, there will be a deficiency. So mainly the people who do not take animal products, like the vegans or the vegetarians, they may suffer from the deficiency symptoms. Or it can happen that you are taking enough vitamin B12 that it is not getting absorbed in your body. So why does that happen? So the core thing lies within the absorption process of the vitamin B12 that is getting hampered, and it is collectively called the vitamin B12 malabsorption syndromes. ठीक है sir? So why does it occur? So if you have got less HCl, less acid inside your stomach, that may hamper the absorption process. That will, so the vitamin B12 part cannot be cleaved, so it cannot be absorbed. So why? So what are the conditions in which acid cell? So in this era, gastritis is a very common problem. Gastritis and GERD, these are very common problems, and we routinely prescribe the patients on the PPI or the H2 blockers routinely, and the patient are chronically on those drugs. So what they cause, they suppress the acid secretion of the stomach. So if acid is less, B12 is also less. So all the patients who are receiving these kind of drugs, does they suffer from B12 deficiency? The answer is no, because the vitamin B12 store is relatively huge inside our body, and even if you do not take any vitamin B12, body cannot be absorbed. The store can still last for around 3 to 4 years inside our body. So patient who is chronically using vitamin B12 for around 4 to 5 years regularly, they may suffer from B12 deficiency. Other things that may affect is what I mentioned earlier, is the intrinsic factor that is produced by the stomach. So there is some autoimmune disease which causes the cells which produces the Capel's intrinsic factor that gets destroyed and produces a syndrome known as the pernicious anemia. That also will cause the same thing. And also if there is some problem with our intestine, this is resected, or if the stomach is resected, like CS stomach, or if the intestine is resected in any disease, that will also cause less absorption of vitamin B12. So that's also, these are the things where vitamin B12 is absorbed less. So what are how that can be replenished, or these problems can be overcome? So if the patient is due to the absorption process is all right, but is taking less dietary intake, so have to improve the dietary intake. We can give vitamin B supplement, B12 supplementation orally by a diet, or we can also give injectable preparations as well. But if the problem lies within the malabsorption, if it's the malabsorption is the cause, then we cannot give oral vitamin B12 supplement. Then you have to obviously go for injectable supplements, which will directly go inside the bloodstream and do function. So vitamin B12 deficiency, it can be relatively prevalent inside in our population, but it is not screened properly. So it must be screened in people who can be affected, like the high risk groups, that is the vegans, or the patient who complain of malabsorption syndrome, that who are anemic. They should be routinely screened. The pregnant patients, the lactating mother, they should be screened for the vitamin B12 deficiency, and it is relatively easy to treat. So if you can screen properly, then we can also treat. So I can give instance of few patients that I have overcome in my practice who suffered from vitamin B12 deficiency. So I can tell about one patient who attended my OPD and had a symptom of a complaint of headache and chronic fatigue for lasting for about 6 months, and the patient was a vegan. So initially we screened the patient for this with the routine blood counts and all, and the electrolytes and all, and then it was came into my notice that the patient was having anemia, and the peripheral blood smear also showed that it having a megaloblastic anemia. So patient is having megaloblastic anemia and is a vegan. So relatively, you can do the calculations, it is. And also the vitamin B12 level and the folic acid level was measured, which was found to be low. And when vitamin B12 was supplemented, the patient recovered and the anemia was also corrected. And another patient that I received, that it was a patient of carcinoma stomach, and who had a total gastrectomy done for to cure her disease, and after several months following the post gastrectomy and post radiation therapy, she presented in our OPD with symptom of chronic headache and memory impairment and cognitive behavioral disturbances. And we also screened that patient after excluding all other organic causes. We screened the patient for the vitamin B12 deficiency and folic acid deficiency. And we found that the vitamin B12 level was relatively less in that patient. And when we supplemented with injectable preparations of vitamin B12, the symptoms also improved further. And I had another patient, it was a young male, I can remember, so 20 years old, and that patient also was promoting vegan diet and having vegan diet, no animal product he was taking, and he also suffered from the same. He had a symptom of chronic fatigue, and we also screened for vitamin B12 deficiency and found to be less, and was supplemented orally. And after around 2 months of oral therapy of vitamin B12, the symptom relatively improved, and he was happy. So this is all about. So vitamin B12 is all about is have to maintain the proper diet through which the vitamin B12 gets inside our body, and it is a very important vitamin in maintaining the body's function, the neural system and the blood system. So it is a very important vitamin inside our body, and whose less amount will lead to severe problems. So vitamin B12 has to be taken with food, and so that the symptoms, these syndromes of vitamin B12 deficiency can be avoided. So, so this was all. Thank you.